Horrific images from a country that tried in showcasing itself as an emerging superpower. 2 years on, almost 3 years on, when the world has moved on and is trying to work its way around the virus, China, the country that gave the world SARS-CoV-2, the virus that causes COVID-19, is back to where it started and is once again trying to follow the flawed zero-COVID policy. On the show today, we tell you about how a strict clampdown on its people is not helping China. Also, what can be expected in India in the next few days and weeks vis-a-vis this pandemic. I'm Sneha Mordani. First up, the country that prides in having the status of a potential superpower brought down to its knees by an infection that originated from its soil. Horrific videos have emerged from China, from the city of Shanghai and elsewhere, where residents can be seen screaming from their windows after being forbidden from leaving their houses for their most basic needs. Here is a detailed report.
A terrifying scene in China's biggest city. Citizens screaming and wailing from their windows after endless days of a total lockdown. Pets of COVID-infected sneezed into bags together. People treated like cattle in quarantine camps. This is what is unfolding in the bizarre lockdown in Shanghai. The cruelest aspect of this lockdown is the treatment of pets whose owners are alleged to be COVID positive. The pets have been tied up into bags together to probably be culled at a later stage. It's not new to see pets killed in China after showing the slightest of symptoms resembling COVID. Here they are paying for their master's sins. Videos like these leaking out of Shanghai depict an unthinkable apocalyptic situation in one of the world's most advanced metropolises. Disturbing proof that the COVID pandemic is far from over. And proof enough that China has failed in its zero COVID policy. And a new wave has brought a mega global city to its knees. Like something out of a dystopian science fiction movie, Chinese authorities have deployed drones to broadcast an ominous message. Control the soul's desire for freedom and do not open the window to sing. This behavior has the risk of spreading the epidemic. The phrase, control the soul's desire for freedom, was a reference to a controversial remark made by a Chinese lawmaker during the first wave of the pandemic in 2020, when the government imposed stringent lockdown measures in Wuhan, ground zero of the coronavirus outbreak. Things are so bad in Shanghai, videos emerging from the city show large groups of people raising slogans and cornering officials wearing hazmat suits before looting a supermarket, an open riot-like situation in several places. The unsettling videos from a rare montage of public anger and pushback against the totalitarian government's ironclad anti-COVID measures. All of Shanghai has been locked down since April 1st. The eastern third of the city has been locked down even longer, since March 28th. The national government has sent in 2,000 military medics and 10,000 medical workers from other provinces to help in the fight against the COVID wave fueled by the Omicron variant. The strain of testing and treatment is taking a heavy toll on healthcare professionals too. A video shared on Twitter showed a doctor being rushed out of an isolation facility carried by patients after he collapsed while performing his duties. Due to China's zero-tolerance policy towards COVID and the strict restrictions, the Consulate General of India in Shanghai has also shut down, forcing Indians to depend entirely on the Beijing embassy. Under zero COVID, all 26 million inhabitants of Shanghai are doing mass testing. Anyone infected must be taken from their homes and quarantined. All close contacts of the infected are also taken away and isolated. The rest have been barred from leaving their homes or apartment buildings. Plans called for 4-day closures of districts while residents were tested. That changed to an indefinite citywide shutdown after case numbers soared. Many residents in Shanghai have struggled to arrange for food deliveries to their homes during the lockdown. Children, including toddlers and even infants, have sometimes been taken from their parents to be quarantined separately, although the Shanghai government is now starting to offer family quarantines for children with special needs. City officials apologized publicly last week and promised to improve food supplies. The country that gave COVID to the world is seeing its biggest city reel from the latest wave. To add to it, China's consumer spending fell and unemployment rose last month as COVID lockdowns confined millions of people to their homes. Manufacturers, including Pegatron, a major producer of Apple's iPhone, have halted operations in Shanghai because of the lockdown. Bureau Report, India Today.
So how has China really got it all wrong? Medical experts world over are of the opinion that this zero COVID policy that China has been so ruthlessly following does not really work. Also, the Chinese people do not enjoy hybrid immunity. The reason being because they do not have natural immunity. Whenever there is an infection outbreak, the government locks people up at home. Stringent lockdowns that we've been seeing in China and many places has angered people. So there is a sense of resentment as well. Poor communication strategy, unlike India where the communication strategy is very effective. Complete eradication is what China is focusing on. By the nature of the virus, that really will never work. This is the problem as far as China is concerned. The strategy has been clamped down and not communication. Cases of COVID-19 are increasing in India once again. Currently, the R value in India is about 1. Experts, however, say that trying to stop transmission will never really work. Instead, the focus should be on protecting the vulnerable and early identification and containing this infection, also improving healthcare. In this report, we tell you why India should not be panicking, not just yet. A 500% increase in COVID cases in Delhi city, streamed headlines. 27% of hospitalizations in Delhi due to COVID are that of children, streamed another. A child has died in a school in Noida. Read another piece of fake news on a microblogging site. But what really is the truth behind this data, these numbers? The news doing the rounds about cases surging, positivity rate increasing, R value increasing. Is this the onset of the 4th wave? Is there a reason to worry? Are hospitalizations going to increase? Is there a new variant around the corner? India Today has spoken to the best epidemiologists and doctors to get the truth for you. These doctors and epidemiologists have been telling us that right now there is no reason to worry, there is no reason to panic. There are 5 reasons why they tell us it's good to be cautious, but we should not be panicking. Cases are increasing. R value or reproduction value has crossed 1 in India. That is the truth, but not completely unexpected. Let's talk about the reasons why you should not be worried. Experts say getting frantic about increased transmission is of no use.
What we need to remember that SARS-CoV-2 will stay with humanity for long, for months and years ahead. In that backdrop, some of the rise and fall in the cases or COVID-19 cases is very likely. So we should not get concerned or alerted with every single rise or fall in the cases. What we should do in the time ahead, that we should focus upon protecting the vulnerable.
Coronavirus is part of our life like any other virus, like influenza virus, dengue virus, adenovirus. So we have to live with it. There will be an increase in number of cases as we do unmasking, but you don't have to panic. If you are vaccinated, you have taken the booster dose, you don't need to panic. What you need to do is take a check on the count, people around you who are sick. If you are sick, you have to stay home, get yourself tested. We know all the basic precautions. You need to do masking when you are moving out in a crowded place, or if you are taking a public transport.
Reason number 2. Children are at no risk or at very little risk of developing severe disease.
There is no evidence that virus is spreading due to school opening. So school should continue to be open for in-person classes. Yes, what is important that high-risk individuals need to protect themselves more diligently.
Reason number 3 why you should not be panicking. There is no new variant of concern yet.
There is no news of a remarkably different variant yet. Until and unless such a news comes, I do not see any reason for panic at this point.
Experience from South Africa and Europe has also shown that Omicron and its subvariants have not caused a devastation like Delta. And therefore, our experience is also likely to be relatively milder than in the past.
Reason number 4, there is no serious illness or deaths. We also have vaccines.
It's becoming less invasive, not attacking the lungs, but sticking mainly in the throat and the nose, or even possibly having mutated to a less virulent form. Alternately, this could be our acquired immunity from prior infection or vaccines protecting us from serious illness. Either way, we are in a relatively safer zone than we were during the Delta wave of 2021. Our health systems are much better prepared now with equipment and facilities. We are geared up with home care facilities, also for emergency transport. Our hospitals are now better equipped with oxygen.
Reason number 5 why you should not be worrying. Experts believe that unless there is a new variant of concern detected, this may actually not lead to a 4th wave.
I believe that we need not panic at all, but we must still exercise caution. It is possible that the pandemic is now reaching a new phase of endemicity, but even then, we cannot take the virus for granted and adopt very reckless behaviors.
From the experience in China and many other countries, we can confidently say that zero COVID is not a viable strategy anymore. With the virus being around, it is very likely that cases would rise and fall. So we should not be worried or concerned with the slight increase in cases in any setting. That is a natural process.
Experts say prudence above panic, common sense above knee-jerk reactions is desirable. In New Delhi, Sneha Mordani for India Today. What about India? How has India done well in terms of the management of the pandemic? To begin with, we learned from our mistakes from the beginning of the pandemic until today. We have realized that stringent lockdowns do not work, and hence, even during the second wave of the pandemic, there were no stringent lockdowns. Lockdowns will not break the chain of transmission is something that India has realized and is working around its way. Also, it knows that the zero COVID policy that China is foolishly following will never really work. India worked on its strengths instead. It improved its vaccination drive, something that's going to protect the population from severe infection. It also focused on improving the healthcare system. Given the lessons from the second wave of the pandemic, India has always put a lot of emphasis on its own communication strategy and has told its people when to mask up and when to follow protocol. Essentially, when the transmission is high, it has gone out and spoken to the people of the country. I spoke earlier to medical experts who told me about China's flawed zero COVID policy and also what India has done right in the last 2.5 years and what the lessons India has learned from its mistakes. Also, given that we are seeing a surge in cases once again, what should India be doing in the next few days and weeks? Listen into this conversation. Joining me now is Dr. Rajeev Jaydevan. Dr. Jaydevan is the co-chairman National IMA COVID Task Force. And also we have with us Professor Gautam Menon. Professor Gautam Menon is the Professor of Physics and Biology at Ashoka University. Thank you both for your time. Today in this special broadcast, we're talking about China and we are also talking about India's response vis-a-vis the pandemic, India's communication strategy as compared to China. Professor Menon, I want to begin by asking you, we've seen clampdown in China. We've seen this attitude that there can't be any COVID, there can't be any infection. The zero COVID policy, which seems to have failed. I don't think any country in the world, barring China, is adopting a zero COVID policy. India has learned how to live with the virus, and the general sense is that we've handled the situation overall better, at least gauging from the images that have been coming in from China. What's your assessment of the situation?
I think that pursuing the zero COVID strategy is a mistake in the long term. Everything we know about COVID-19 and the different variants that have afflicted the world since the pandemic first started suggests that it's very hard to control once it gets about in the population. The Indian strategy of speeding up vaccinations and vaccinating a larger fraction of the eligible population, and indeed expanding the eligible population, is, I think, the right one. What we should do now is to get boosters to those who are eligible for boosters, who require them, and make sure that as much of our population is covered. But pursuing a strategy of zero COVID, as China has done, is, I think, ultimately a mistake because it is just not sustainable anymore.
Dr. Jayadevan, not sustainable is what Professor Menon says. You have spoken about this in the past as well. In that sense, what do you make of India's own strategy vis-a-vis improving our vaccination rates? We're giving out boosters to those above the age of 18. India has also approved vaccines for those above the age of 5. This development has just come in fact. And also, there's been a lot of focus on communication. Each time cases increase, we've seen the government of India get actively involved in its communication strategy, telling people what's to be done. Do you think that in the longer run, this is going to pay off?
Yes, as you said, communication is one of the weapons that can be used to effectively control the pandemic. And if it's done wrong, it can do the opposite. And we saw that in several nations as well. In our country, the government has communicated effectively to the grassroots level, this is my opinion. In the beginning, when there was very little information about the pandemic and there was no vaccine or effective treatment available, and the long-term effects were unknown, the strategies were different than they are now in April 2022 as we sit here. Once vaccines were available, the government had figured out that COVID-19 is not, by then, COVID-19 was not a disease that was affecting all ages from 0 to 100 alike. Far from it, it was exponentially or more disproportionately affecting people who were in the older age group. And along with that came some comorbidities as well. It's difficult to say if comorbidity alone is the cause, because we all know that with age is linked comorbidity. So it's difficult to decouple the two. But regardless, people who were older were at much higher risk. So the vaccination process was prioritized to that segment, and also to the healthcare workers and frontline workers who were, there were plenty of deaths in that segment in 2020, as you recall.
What has India done wrong in its handling of the pandemic in the last 2.5 years or so? And what can it do better, given that once again, we're seeing an increase in cases?
I think one thing that we have been doing wrong consistently is concerning data and the availability of data. This has hamstrung the abilities of states and centre, as well as people outside government, to try and get a better fix on the pandemic. We should ramp up our sequencing to search for new variants as and when we see a rise in cases. That's again questions of surveillance and efficient surveillance are questions that will keep arising, not just now, but in the future. And these will really affect our handling of COVID-19. Certainly, there have been problems in the past. The availability of oxygen during the Delta wave in Delhi and many other parts of the country was certainly a mistake, and that should have been prepared for at that time. But really, I think the overwhelming concern that I have right now really concerns data availability, because that is central to our ability to respond and to understand what might be changing about COVID-19 in India.
Dr. Jayadevan, given that China is by and large seeing an increase in cases owing to Omicron, which is the 5th variant of concern, do you expect a repeat of the situation in India as well? The question that is most frequently asked is whether this really is the onset of the 4th wave.
It is perhaps unwise to characterize COVID as waves. I look at it more like a mountain range with a few peaks in between. The concept of waves suggests like a sine wave pattern where it's either a yes or a no. But COVID-19 does not work in a yes or no pattern. There are periods where there are fewer cases, and there are periods where the systems can be under duress. So at this point, we are going through what I call a tail phase of Omicron. because the variants that are circulating around the world and that are causing substantial disease around the world right now are all sublineages of Omicron. So since the wave hit India in January and fizzled out by early March, now we are in April, end of April, closing in on May. There will be a few reinfections, and there will be infections of people who've not been infected in the third wave. So from that standpoint, we're going to see a slow burn. But if if the behavior of the community, that is, if it is not pandemic safe behavior, this virus has the ability to infect large numbers of people in very little time. And we know it can affect young, healthy individuals. It can take them down to such an extent that it can incapacitate them. It can make them bedridden for several days, requiring IV fluids. And it is not a common cold. So it must be taken with substantial severity or with seriousness, if you will, that it should not be allowed to spread beyond a limit.
Yes, but coming back to China, once again I want to ask Professor Gautam Menon, I think it's become very, very clear, and I think India also followed, at least tried to follow this strategy of wanting to break the chain of transmission that we tried to do in the first 21 days of the lockdown starting 2 years ago on the 24th of March 2020, and that obviously was not successful. What China is trying to do right now again is break the chain of transmission, ensure that infections don't cross from Shanghai to Beijing to Xi'an and to other places in the country, but that obviously is not going to work. We really don't have any option, isn't it, Professor Gautam?
It appears as though a long-term strategy of zero COVID is simply not going to work. It imposes a lot of stresses on the population, lots of economic difficulties, a lot of social difficulties in terms of the very large-scale movements of populations to confinement zones that Shanghai is currently seeing. It's unlikely that this can be sustained, as I said, for a long period of time. We may just simply have to figure out better strategies, and one strategy certainly is vaccination. Another strategy is masking. The third strategy is improving ventilation across the board. A fourth strategy is doing surveillance of high quality to ensure that you pick up these cases and you try and identify them and locally at least try to deal with them as fast as possible. It's all of these together that will enable a long-term response to COVID-19.
How soon before we know what led to the outbreak and who was behind it?
Yes, the knowledge base at this point, allowing for some differences of opinion, is for the most part that the virus originated in an animal and moved to humans after passage through an intermediary host. This virus is already showing its ability to infect multiple animals. So the way an intermediary host works is that in an animal market, when multiple species of animals are housed in close quarters, either for sale or for food or otherwise, when they're still alive, the virus gets a chance to jump between species. And while many jumps are not successful, one such jump might turn out to be like rolling the dice a million times, and then once in a while you get the combination you need. So that is what likely has happened, and there is no doubt that this virus is able to infect large numbers of mammals all around the world in such short time. So that is the knowledge base at this point, and as it found its new host sometime at the end of 2019, it is continuously adapting to be able to spread better and to escape its host immune response. And the clear proof of that is we now have well-documented published evidence from immunosuppressed individuals where the virus has lived for well over a year and has sequentially produced mutations based on the treatments given. For example, if monoclonal antibodies were given, specific types, the virus is able to adapt, produce a mutation, and then undo the change if needed in the future. These are fascinating studies that shows that this organism can adapt live according to whatever its environment throws at it. So this is a continuously adapting organism that we're dealing with, and it's not going away.
All right, so there is unanimity that the zero COVID policy that China has been so ruthlessly following, so relentlessly following, is something that does not work, is something that will never work. The virus is here to stay, and the way forward is trying to work our way around this virus. I'm thanking Professor Gautam Menon and also Dr. Rajiv Jaydevan for joining us and for sharing their views with us on that very important and interesting story that we are following. Close to 3 years, the world is still grappling for answers as to what led to the virus outbreak. Whole virus origin investigations take a while. China continues to stonewall the same. Here's more. Not one country unaffected. The coronavirus has touched everyone in the world. What possibly started as a cluster outbreak in a wet market in China's Wuhan spread like wildfire. 2.5 years on and millions of mutations later, the one answer everyone is looking for is how did the outbreak happen, and was this a lab leak or was it an outbreak in Wuhan's market? The latest report published in science journal Nature, which throws light on 3 studies, says that the Wuhan market was indeed the epicenter of the pandemic. It says the virus did indeed jump from animals to people in 2 occasions towards the end of 2019. None of the studies say anything conclusively about the animals who could have been the host. A suggestion is that raccoon dogs could have been the host. They are widely used for their fur and meat in China.
This virus will continue to...
The WHO's Scientific Advisory Group on Origins of Novel Pathogens will study and advise the world body on the same. But there has been little movement on the investigations. The progress of previous scientists undertaking these studies has been rather slow. In March 2020, the Chinese government asked researchers to have all studies on COVID-19 vetted by the government.
Never failed to deeply move.
Even as the lab leak theory pushed by former US President Donald Trump gives the pandemic the flavor of a scandal, the WHO says that politics must be kept away from science and that those assigned the job of finding the origins of the virus must be allowed to do so. In New Delhi, Sneha Mordani for India Today. That is all we could pack in today's special broadcast. Do continue to watch this space for the very latest on the pandemic. COVID protocol is back. The virus has its ways, remember, of surprising us. And let's not allow it to get the upper hand this time around. Do get vaccinated, and if you are due your boosters, do get your booster shot. Stay safe. Thanks for watching.